to the beer. Cases be brave, one iti panic on yam. Mengase tipa no enye, but your case
could have been done at the Kolebu Polyclinic or something. They have a polyclinic. There's Manprobe Polyclinic, there's Dansoman Polyclinic, all of them can handle some of those cases. Dr. Imana Dipadapo is a medical officer himself, works at the Greater Accra Regional Hospital, senior medical officer. Thank you very much for your time and a good morning to you.
Good morning, Senna. Thank you for having me.
He does a lot of advocacy when it comes to matters of health on behalf of the patients and also on behalf of the health workers. I must admit that in some cases, he's taken on his own people in many write-ups when it comes to their actions. This time around, it seems you disagree with the health minister. Explain to us why.
Yes, good morning once again to your listeners and your viewers on Facebook and all other social media handles. Yes, I totally disagree with the stance of the health minister this time around against what is purported to have been that the consultant, Dr. Beidou, is being shown guilty even before any investigation is conducted. The reason is, in fact, this transparency by writing a letter to the peripheral hospitals to hold off referral to the Konfanochi Teaching Hospital is the best communication any doctor involved in emergency care and patient safety would have given under the circumstances. It is not, as the health minister wants it to seem, a flouting of the directive of the president. Look, Konfanochi Teaching Hospital serves the middle belt and the northern zones of the country. It is the only tertiary hospital in that enclave. People are sometimes even referred as far as Tamale, Yendi, and all those enclaves to Konfanochi Teaching Hospital for specialist care. And the emergency area has the capacity to take only 37 people. Now, emergency care is not just an ordinary OPD case. Sometimes there are only one or two doctors on duty to run a shift of 12 hours back to back. And this time, the ward had taken on over 67 cases or so, with a capacity of 37. And some other people were also sitting in chairs and waiting in line to be catered for. Look, we are having a surveillance of Ebola outbreak. And we have not taken into consideration how a jam-packed emergency area will affect people who are already on admission, some of whom are critical in the red zone, who need monitoring 24 hours. Some of whom are in the orange zone, who also are severely sick and need monitoring. And others are in the green zone, who are stable, but may not have been transferred to the various wards because of this bed capacity. However, the CEO and all doctors on duty did not turn away any patient. They kept receiving them, but they alerted the peripheral hospitals to hold on for just 24 hours so that they could decongest the place. I don't think the health minister took into consideration nosocomial infections or hospital-acquired infections that patients who come with infectious diseases will transfer to other people on admission. Secondly, I don't think the health minister took into consideration the burnout that the doctors and nurses on duty will be having. Thirdly, I don't think that the health minister took into consideration the knowledge and the consideration of patient safety that a consultant orthopedic surgeon would have put in before making such a decision. Look, sometimes let us ask in a way that when we put people who are technical people in positions, let us give them the benefit of the doubt that whatever they are doing is to the benefit of the patient and not otherwise. No doctor goes to the hospital and says that I am turning away patients on purpose. Look, it is the rainy season. Even common cold can kill a patient who is critically ill. And somebody who comes as an emergency case in an already jam-packed, the emergency area was filled more than 200% of the capacity. In fact, I beg to differ this time around. I agree totally with the Ghana Medical Association that, look, the health minister, with all due respect, has disrespected the decision of the consultant surgeon. In fact, and look, it is not well. Every platform of the Ghana Medical Association, every platform, all doctors are very angry because we do not know what will happen to anybody who tries to do the right thing this time around. People think that the doctor in question wants to make the government unpopular. Who told you so? Who told you so? Dr. Pagbedu is one of the doctors who actually whipped up the lab of doctors in the Ashanti region for this government.
Is this to suggest that the decision he makes, even though you say it's the best decision, cannot be subjected to administrative review?
It can be subjected to administrative review. I believe that the Minister of Health could have done better. Look, with all intents and purposes, the Minister of Health is not a medic. Certain decisions that are taken, that he thinks are taken on the rush, he could ask for better and further and better particulars to explain to him.
Is it the assumption that he didn't do that?
He didn't do that. He just called the doctor to his office, asked him a few questions, and then by the time we realized the suspension was on social media. And you see, look, listen, certain things, suspending a consultant and we see the letter on social media, that is disrespect in the face of medical practice. I am very disappointed. I am really disappointed, and I am not alone in this. Many doctors,
and you know for a fact that he called the doctor into his office. They had a conversation, and the next moment he didn't even tell the doctor that we've decided to suspend you or something. Nothing was told to the doctor.
You look at the way the query letter even came. The query letter assumed the doctor was guilty before even any investigation went on. He just asked the chief director to send him a query, and by the time we realized the query was all over on social media. Whoever leaked the query letter to the consultant, we didn't know. The next minute, he was summoned to Accra. And let me tell you, listen, the consultant is not only in an administrative role. He is also in a teaching role. He is teaching rotational doctors who are under him, rotating in orthopedic surgery. Secondly, he is also teaching house officers. Mm-hmm. Thirdly, he is teaching residents who are under him. Fourthly, he is the supervisor of all medical officers who are rotating under him. Mm. So the suspension for 2 weeks, what happens to those who are rotating under him?
The ministry says the suspension affects his position as chief executive of Kath.
Yes.
That it was in line with that. Then not as a medical officer of the hospital. That as chief executive of the hospital with the capacity to take these decisions, we've taken away that power from him.
Yes, and I'm saying that was a rash decision to have been taken. Look, a letter of caution in the first place would have done, because even if you think that the chief executive officer did something wrong that you thought was in flouting the president's directive, you could caution him first with a caution letter, since this is a first-time offense, presumably. But to just take that high-handed, decision to suspend him, is it to show power?
Mm.
No.
No, the suspension is not a fine. is not necessarily to say you are guilty, is it?
No, but you see, the query said he should come and explain why disciplinary action should not be taken against him for the decision he made. Does that not presume that you are guilty and you need to be punished if you don't explain yourself well?
But you are sure that he's on solid ground.
I'm sure
That is
he's on
something
solid
that
ground.
could have been explained that way.
I insist that the communication is transparent enough. No emergency center admits patients in perpetuity. Considering the burnout that doctors and nurses and other medical, allied health professionals are going through in the country. My brother, a consultant anesthesiologist has left the country recently. He is in Canada as we speak. People are resigning because of some of such rash decisions that are being taken. And all is not well. So those of us who have dedicated ourselves to service, this is not the way to treat us.
Mm.
And let me tell you, Dr. Pagbedu is one of their own. Look, the Ashanti region has been known, the Ashanti region Ghana Medical Association has been known to be very antagonistic to government. But this time around, do you see anything like that going on? Let us not take lightly the contributions of people, and because they don't show it in public, we think that they just emerge on the scene.
Mm. I see. So for you, this decision was rushed. Shouldn't have been taken.
I'm telling you, this decision was rushed. This decision was rushed. It should be reversed. It should be reversed. The consultant surgeon should be reinstated immediately to do his work. And of course, even within the 24 hours, the place was decongested. Just as he said it would. Because they need to take time to decongest the place. And then they can admit new people. But you see, if, for instance, just as the president said, nobody should be turned away. If people come to the place and they are not turned away, there will be delay. So that is why he said, please don't bring them immediately. Look, many people don't know that these consultants even consult on phone. There is telemedicine. And then what are we practicing telemedicine for? Telemedicine, the consultant is able to guide doctors through treatment. And they are able to treat patients who otherwise would have been referred. For instance, if there is a patient with diabetic ketoacidosis and maybe a doctor in the periphery who does not know how to manage, the consultant is able to take them through the management, and then he follows up so that they don't necessarily come to the referral site and add to the burden. Secondly, the death toll increases when patients are delayed and those already on admission are not well taken care of. Thirdly, doctors and nurses become burned out because, look, we have a backlog of doctors and nurses at home who have not been employed yet. And the ones already in the system are being subjected to such heavy loads of work. Is there no mercy at all?
And it's on this basis that you say the minister should not have taken the decision, but you also understand that an appointing authority can at any point in time institute administrative actions against any appointee, not minding whether he's guilty or not.
Well, I agree, but you see, when it comes to such essential services, certain decisions are to the best of. Look, let me give you a scenario. Obstetricians can go into theater with the aim of just doing a simple myomectomy, or in layman's language, removing fibroid tissues that are causing problems in a woman. Then on the theater table, the woman begins to bleeding to such an extent that even the womb becomes so much soaked with blood that it is virtually useless. If you leave that womb in the woman, the woman is going to bleed to death. So what does the doctor do? The doctor has to take the harsh decision to take out the womb and save the woman's life. Certain rash decisions are taken by medics not at the convenience of anybody or not as the optics would have it shown that these decisions must please the optics or must please the masses. But they are decisions that are taken for the safety of the patient who is under our care and to whom we have the duty of care.
What would have gone wrong if the CEO had been suspended, left post? Exactly what would he have spoke? What would have been damaged?
What would have happened? What would have happened is that another doctor will not take that decision. They will play it safe, and then we will begin to have the consequences of certain things like delayed management. And doctors may even become lackadaisical. They will not rush to take decisions that will implicate them because the politician, they are at the mercy of the politician. So this is what is going to go wrong. Thirdly, I'm telling you, we are surveilling Ebola. We are in the surveillance period. There is Ebola outbreak in some African countries. We do not want that to happen in Ghana. We expect that the doctors at the emergency centers will be our eyes on the ground. They should have a high sense of suspicion to pick out those diseases. Do you think that if a patient comes and has to wait for a long period in the emergency area, if that is a suspected case, what do you think would happen before we get to know? And even in this rainy season, there are some infectious diseases that are already in the system. Common cold. Common cold can affect somebody who is on a ventilator in the emergency area, brought in by a new case in an overpopulated or overcrowded area. Nobody is going to say they are going to take any initiative to correct that.
Doc, thank you. Thank you very much for explaining your position.
You're welcome.
Yeah, that's Dr. Emmanuel Adipadapo's position on this matter. He doesn't mince words. He states his position on every matter that counts as far as it concerns healthcare. In this case, he disagrees with the health minister on this. We'll be speaking to the Ashanti Regional Minister shortly on his own intervention and what results he has yielded. We'll have that conversation shortly. So we're just having a conversation with Dr. Emmanuel Adipadapo on the ongoing impasse at Confanoche Teaching Hospital, that's Kath. Now, it started when the suspension of the CEO of the hospital was announced for taking a decision the health minister thinks was against laid-down procedure, considering they've been interested in what happens in emergency and accident cases. Remember the directive that was issued by the president, that the health minister felt the decision that he took to close down the accident emergency center or say nobody should send referral cases, communicating to hospitals all across, that the cease referrals for the next 24 hours because they needed to deal with the congestion of the place.